Imagine the human brain as a bustling city. Neurons are like busy streets buzzing with activity. Signals zip around like cars, carrying important messages. Different parts of the city manage unique tasks, memory, speech, movement. When everything functions smoothly, the city thrives. We think clearly, communicate easily, and go about our days with purpose. But what happens when something disrupts this intricate system? This is where we encounter the puzzling and often frightening phenomenon of delirium. Delirium is a sudden change in the brain's normal functioning. It's like a temporary state of confusion where thoughts become jumbled and the world might seem disoriented. Imagine a sudden blackout in our city analogy. Traffic lights go haywire, communication breaks down, people become lost and disoriented. Delirium is a medical condition, not a sign of weakness or a character flaw. It's often triggered by an underlying medical issue like an infection, medication reaction, or surgery. Recognizing and addressing the root cause is crucial for recovery. Many factors can contribute to delirium, just as various events can disrupt a city's operations. Delirium is a serious disturbance in mental abilities that results in confused thinking and reduced awareness of the environment. It can be compared to the chaos that ensues when a city faces unexpected disruptions. Think of a severe traffic jam caused by an accident. This sudden blockage can halt the flow of traffic, creating confusion and frustration among drivers, or a sudden power outage that throws everything into darkness. The city's normal operations come to a standstill, and people are left disoriented and struggling to find their way. Similarly, common culprits of delirium include infections like the flu or pneumonia, which can inflame the brain. These infections can cause the brain to swell, leading to confusion and disorientation. Medications, certain drugs, especially in older adults, can have disorienting side effects. Some medications can interfere with brain function, causing symptoms of delirium. Dehydration, just as a city needs water to function, so does the brain. Without adequate hydration, the brain cannot operate properly, leading to confusion and cognitive impairment. Sleep deprivation, prolonged lack of sleep, can disrupt brain chemistry. When the brain is deprived of sleep, its ability to function is compromised, resulting in delirium. And alcohol or drug withdrawal, sudden cessation, can trigger delirium. The abrupt stopping of alcohol or drugs can shock the brain, causing severe confusion and agitation. Identifying and addressing these underlying causes is paramount in treating delirium effectively. By understanding the root causes, healthcare professionals can develop targeted treatment plans to help patients recover and regain their mental clarity. Section 4. Lost and confused. Recognizing the symptoms. Delirium often manifests as a cluster of symptoms that can fluctuate throughout the day. Imagine someone wandering through our city during the blackout, disoriented and confused. They might have trouble focusing or following conversations, experience memory problems, forgetting recent events, seem disoriented to time and place, exhibit sudden mood swings from tearfulness to agitation, and hallucinate, seeing or hearing things that aren't there. These changes can be distressing for both the individual experiencing delirium and their loved ones. Section 5. Finding the root of the problem. Diagnosis and treatment. This section delves into the critical steps involved in accurately diagnosing and effectively treating delirium, a condition that can significantly impact a patient's well-being. Diagnosing delirium involves a multifaceted approach requiring the collaboration of various healthcare professionals to ensure a comprehensive evaluation. Doctors will review medical history and conduct a thorough physical exam, looking for any signs that might indicate the presence of delirium. They will also assess mental state through cognitive tests, which help in identifying any impairments in thinking, memory, or perception. Additionally, they may order blood tests and imaging scans to rule out other conditions that could be causing the symptoms, ensuring a precise diagnosis. Treatment focuses on addressing the underlying cause of delirium, which could involve treating an infection, managing chronic illnesses, or adjusting medication. For instance, if an infection is identified, antibiotics may be administered, or if medication side effects are the culprit, adjustments will be made. Supportive care is equally important in the treatment process as it helps stabilize the patient and promotes recovery. This includes providing a calm and quiet environment which can help reduce confusion and agitation. Ensuring proper hydration and nutrition is also vital, as these basic needs can significantly impact a patient's overall health and recovery. Offering reassurance and orientation cues such as reminding the patient of the time, place, and situation can help them feel more secure and less disoriented. Involving family members in the care process is crucial as their presence and support can provide comfort and aid in the patient's recovery. Timely diagnosis and treatment are crucial for improving outcomes and reducing the duration of delirium, ultimately enhancing the patient's quality of life and facilitating a quicker return to normalcy. Section 6. Navigating the maze. Caring for a loved one with delirium. Caring for someone experiencing delirium can be challenging, but there are ways to provide support and comfort. It's important to stay calm and patient, as your demeanor can greatly influence their state of mind. Remember that their behavior stems from a medical condition, not a personal failing. Understanding this can help you approach the situation with empathy and compassion. Provide clear and simple explanations. Speak slowly and use straightforward language to avoid confusion. This can help them feel more secure and less anxious. Use short sentences and avoid overwhelming them with too much information at once. Offer reassurance frequently and help them stay oriented. Remind them of the date, time, and their surroundings regularly. This can help ground them in reality and reduce feelings of disorientation. Create a safe and familiar environment. Minimize noise and clutter to reduce sensory overload. Encourage communication by being present and attentive to engage them in conversations, even if their responses seem disjointed. This can help maintain their cognitive functions and provide a sense of normalcy. Remember, you're not alone in this journey. Seek support from healthcare professionals, support groups, and community resources. These can offer valuable advice, emotional support, and practical assistance to help you navigate this challenging time. Section 7. A beacon of hope. Understanding and support. Delirium can be a frightening experience, but it's essential to remember that it's often temporary and treatable. By understanding its causes, recognizing its symptoms, and providing appropriate care, we can help our loved ones navigate this challenging condition. With timely intervention and compassionate support, the lights can come back on and the city in their minds can return to its vibrant, bustling self.